This year's World Health Day calls on us to reflect upon the need to do all we can to protect humankind against the adverse effects of climate change and the warming of planet Earth. It is no longer possible to describe these changes as simply the will of nature. The world is witnessing new and sustained climate dynamics that are negatively affecting the health of large sectors of the world's population. Climate change is a global phenomenon, but some regions and some population groups are more vulnerable than others. Each year, some 800,000 people die as a result of the contamination of the air they breathe in major cities. Some 2 million people die each year because they lack access to clean, safe water and even the most basic sanitation systems. Malnutrition kills approximately 3.5 million people every year, and some 60,000 die as a consequence of natural disasters. Many of these deaths occur in the region of the Americas, where also 1.7 million are affected, and more than 20,000 die of diseases transmitted by insects like dengue, malaria, yellow fever, Chagas, and leishmaniasis. Since climate change is already impacting heavily on the most basic determinants of health, such as air, water, and food, it is imperative that we address the root causes of the problem so we can prevent these deaths, suffering, and destruction. Governments and leaders of the Americas can and must face with determination and vision what needs to be done in terms of urban planning, transportation, energy production and distribution, food production and safety, and the sustainable use of land and other natural resources that have been placed in our care on a temporary basis. This World Health Day dedicated to climate change reaffirms as never before our unequivocal determination to place health among our highest priorities. The problems we face now and in the future require decisions and actions that are politically courageous, technically innovative, and effective in the real world. Protecting our guiding principle of health for all will depend in great measure on how we meet these challenges. We know climate change is a reality. We are also conscious that the threats to our health are real, if in any case latent. Fortunately, we can still do something about it. In the Americas and throughout the world, we still have time to act to protect health against climate change.